Hi, this is Pam with Your Nurse Advocate Consulting. We are having some really bad storms, so I'm hoping that we stay online for our Tuesday tips. So, welcome if you're joining us live on our Facebook page. Otherwise, I will be recording this, so the replay will be available in a day or two. So, we are wrapping up everything on our theme of the month of May for aging in place. And so, this topic, we had wanted to talk about managing chronic illnesses and chronic conditions and how that can impact your plan on aging in place. And speaking of aging in place, I just want to point everybody out. We are real excited. We got our video interview completed, and it is posted on our YouTube channel, and that is with Brent Wilkerson. He is the production manager from Cross Country Mortgage out of La Crosse, Wisconsin. He was very gracious enough for me to fire at him all the questions, the good, the bad, the ugly, regarding reverse mortgages. And so the topic of that was, does a reverse mortgage have value in an aging in place plan? So I really encourage you. There's been a lot of bad raps about reverse mortgages. The government has changed some of the regulations. It's much better. I was really surprised at what I learned. So I encourage everybody to go over to our YouTube channel and take a peek at our new video out on reverse mortgages. So let's go ahead and move forward to our discussion for today. And that is, when you're looking at aging in place, it's really important to stay on top of any healthcare conditions. So it's important to have regular health checkups. If you've been diagnosed with a chronic disease, such as maybe COPD, chronic obstructive pulmonary disease, CHF or congestive heart failure, you get frequent pneumonias, maybe you have arthritis or MS or lupus or some other chronic condition that as you age, the normal course of that, you may expect that you may need other things in the home to age in place. So if you're doing pretty well now, let's take chronic obstructive pulmonary disease, COPD, as an example. So maybe now you're still getting around okay. You get a little short of breath. You have some medications. You maybe have a rescue inhaler that you use. But what's the expected course of that diagnosis? So when you're looking at plans and aging in place, chances are at some point in time you're going to need oxygen. And maybe at some point in time you're not going to be able to perform all the activities of daily living that you can maybe do now. So is your home conducive for caregivers? Is it handicap accessible? Can you get more than one person in the bathroom? As you start to think, and this is where a nurse advocate can come into play. We can help you by talking to you and reviewing your problem list and seeing what chronic illnesses or disease processes that you're managing right now. We can help predict in the future what your healthcare needs might look like. Obviously, we don't have a crystal ball and we can't say for sure, but we have a good idea of what kinds of things that we should consider as you continue to age and as you continue to progress with this chronic disease or illness. And so it's really important that for wanting to age in place, that you have the proper equipment or the room or the adaptive or the modifications to your home. And it's important to start on those things sooner than later, because it gets more difficult. And as your health challenges get worse, you may have more hospitalizations, you may have more medical bills. So if truly your goal is to age in place, it's real important to plan early, plan ahead, so that we can look at the home and what services you might need, how that's going to be afforded, and all those kind of things as we're putting it a plan to age in place. So to give you kind of a real world example, we had a client that was diagnosed with Alzheimer's disease, and it went very quickly from the time that she asked me to come and see her, and she was withdrawing, not going to church because she couldn't remember her friends' names that she's known for many years. From that time to 9 months later, before she passed away. So she had a very aggressive form of Alzheimer's, but her husband's wish was that she stay home with him. He did not want her to go into a nursing home. So Their plan was to age in place with her dealing with her Alzheimer's disease. So it didn't take us long to determine the course of the illness and what needed to be done for her. So home modifications included locks, alarms, window locks, locks on the cabinets. We had to lock up her medications. She was a flight risk. She would climb out the window, try to get out the door. She would try to ingest things that she shouldn't, shampoo, cleaning fluids, things like we had to keep all of that out of the way and out of her reach and locked up. Eventually, the plan led to 24/7 caregivers. So we had someone in the home. We had to create a whole village of volunteers. We had people bringing in meals. We had companions, people to sit. We had, like I said, round the clock caregivers. So this was a plan that was constantly evolving over the 9 months. But we were able to keep her home with her husband. And so, aging in place can be difficult at times, but where there's a will, there's a way. And sometimes it's not impossible, but you have to plan, and you have to have the right circumstances, and you have to have the support system that you need to be able to implement this plan and keep this plan going if your choice is to age in place. So when we're talking about proactive management of chronic conditions so that we can allow you to age and stay in your home for as long and as safely as possible, we're talking about making sure symptoms are managed properly and ongoing, because if your symptoms are managed and you stay on top of that, there's going to be less surprises, less emergent reasons that you're going to have to leave the home, go into the hospital. If you're having frequent hospitalizations, you're getting you're getting weaker. I mean, then you might find yourself in a nursing home for a while. And then eventually what's going to happen if we don't stay on top of these things is the day is going to come where someone may say, you know what, we don't think that you should be able to go home anymore. You might need a nursing home. So it's really, really important that you stay on top of everything related to your chronic diseases so that we can help manage that and keep you as home as long and as safely as possible. So when you're aging in place, what are some of the barriers that keep you from, accessing your healthcare to stay on top of your chronic conditions? And that would be mobility issues. If you have difficulty getting out to medical appointments, you live in rural areas where medical transportation isn't as accessible. Maybe you have some financial constraints. You have limited income, that is affecting your ability to get treatments. And lack of awareness, not knowing about available resources and services. And again, that's where a nurse advocate can come in. We can come in and connect you with those resources and advise you on what things are available, because it's difficult when you don't know what you don't know. So to overcome some of these barriers, we've talked in the past, this whole month, we've talked about a lot of these things. And so just briefly was telehealth services. Telehealth services is getting so big, like we shared Dr. James Williams' video on his whole practice is telemedicine with seniors, and how it's come down to just having someone there with a smartphone. He has Bluetooth stethoscopes. I did try and spit that out there for you, that can listen to heart sounds, lung sounds, bellies, so it has come a long, long way. Community medical transportation. There are a lot of cab services that just for the cost of a cab, they can accommodate a wheelchair and things like that. So there are also financial assistance programs. As I tell everyone, if money is tight and there are issues there, please don't look at that as a barrier to getting care and to getting treatment. The Aging Disability Resource Center is in every county in the state of Wisconsin, and in all the counties across the country. They may not be called the Aging and Disability Resource Center, but they're the Senior Center on Aging, Human Services Aging Department, Senior Department. Every county has a government agency designed to support and provide resources for our seniors. So if you're not sure what that's called, reach out just to the health department, and they would be able to help you determine what is the correct name and how to reach that senior aging services. So we talked about the management plan. We talked about regular check-ins with your healthcare providers. Medication adherence, it's important to stick to your medication. I know a lot of people that have congestive heart failure. They don't like taking their water pills, their Lasix, their diuretics, because it makes them go to the bathroom more frequently. It's hard for them to get out because they skip it. If they're going to do some activity, they may skip it for a day or two. Well, sometimes that's all it takes for the swelling to pick up and to get yourself into trouble by skipping those medications. So it's important that we talk about ways to work around that, so that you're not skipping your medication doses, but yet you're able to still have a quality of life. So there are things that we can do and try and take care of in those situations. Goal setting, maybe make sure we're establishing short-term, long-term health goals, and then taking into consideration what that aging in place may look at. Monitoring, there's home monitoring systems that, programs that a lot of the clinics have. There's congestive heart failure home monitoring, there's diabetes home monitoring, hypertension, chronic obstructive lung disease. So there's a lot of programs that help to manage these chronic illnesses while you're in home. And then the last thing is just a support system. It takes a village. So it may take your clinic, it may take a social worker at the clinic, it may take a nurse, your nurse advocate, friends, family. It takes a village for you to be able to successfully age in place. And we talked a lot about, in the past, about loneliness and isolation issues, about making sure that your social needs are met as well. So these are all part of the big picture, all part of the big plan for you to age in place. So when we talk about the village and the role of supportive healthcare team in managing these chronic illnesses, that could, you're going to need help with coordinating care. A lot of clinics have care coordinators, transitional care nurses that help coordinate appointments, try and get you in, if you have multiple appointments, try and get you on fewer days so that you're making less trips. They may do a couple follow-up phone calls with you, personalized advice that they can help you with that. There's home health care, there's your nurse or patient advocates, emotional support. You want to make sure that you have a support system to lean on, and connecting, having access to resources. And again, your clinic, social worker, transitional care nurse, nurse advocate, all of us are able to help connect families and our clients with essential services and programs. So we talked about some examples, and in conclusion, I just want to say that a nurse advocate is something that a lot of people don't know about, and they really don't know what we do. And to give you a good example, just have a new client. The son reached out to me and said, my dad's had some heart surgery. He's at home. Him and my mom are aging. My mom is having trouble taking care of him. We're looking at assisted living, but they may want to age in place. I don't know how we're going to do this. We need to put a team together. Can you help? Absolutely. That is one of the things that we do, is help put plans in place for people to be able to age successfully in the home. Even if we're looking at 24/7, around the clock care, that is something that we can help coordinate and pull together and create that village to support you. So as we conclude our May theme in aging in place, it's clear that regular health checkups and proactive management of your chronic health illnesses are vital for our aging adults, our seniors wishing to maintain their independence and their quality of life by aging in place. So by overcoming the barriers to healthcare and developing, these comprehensive health management plans, our seniors can continue to thrive in their own homes. So this is going to wrap up. This is our final Tuesday tips on aging in place. We have our webinar tomorrow night, Aging in Place, our big free comprehensive webinar with workbook and everything. So if you have not registered and you want to deep dive and pull everything together and see how aging in place would work for you by inserting your unique situations, please, go ahead. It's not too late to join us. For tomorrow, it starts at 7:30 Central Time. It'll go for about an hour and 15 minutes. Like I said, there's a workbook that goes with it. You can take notes and apply things to your situation. And if that feels like that's going to be a fit for you, then I look forward to seeing many of you tomorrow evening as well on the webinar. So thanks for joining us, and we'll see you back for another Tuesday Tips. Take care.